So what are the three most common questions that you've been asked this week about sedation?
I think the first question I get asked a lot is, can I have sedation, or how do you know that I can have sedation? And the most important thing is to do all the health and safety checks, and that means checking your blood pressure, checking your medical history, checking your BMI, and ensuring that we can get kind of the drug access in, and more than likely most patients can be sedated successfully at the practice. I think sometimes patients will say, oh, I'm not sure whether I should try sedation or not. That's also quite easy to kind of handle, because there's a small questionnaire sheet which kind of actually gives us a scoring system which tells us your indication of sedation need, and if it's over 12 then we know that the patient could benefit from sedation, which is a really useful tool for a lot of patients. And I think the last question is, am I only allowed to have sedation for an extraction, or am I only allowed to have it for something, particularly difficult or a complex treatment? And we can do sedation for any kind of treatments for our patients. Some patients will have it for something like a scale, even just because they find that kind of a very difficult procedure. And what we always do is try and group as many things as we can together to reduce the number of sedations required. So for instance, if a patient needs maybe an extraction, a clean, a couple of fillings, we try and do that all in one sedation, which is a great benefit.